so everybody knows, we have Charlie and Adrian here.
Arienne.
Oh, that's
Arian.
so
Oh, I'm sorry. Oh, you have
Arian.
Charlie and Arian here. I actually knew that, yeah. But yeah, it's a pleasure to have you guys.
Hey, thanks for having us on. And we've enjoyed talking to you guys too.
Yeah.
I love the fact that you call it an opportunity, because that's a word I'm getting used to now with
Yeah,
this
right.
deal. Helping kids is something we've done for a long time. Really getting into the Medicaid program back in 2011, 2012, and noticing that this program was very state specific in the type of care and also the type of staff that you could provide in certain areas based on what the reimbursement rates are per state. Even though Medicaid is a federally subsidized program, it doesn't necessarily mean that every state is taking that federal subsidy. Texas happens to be a great state with great margins when it comes to offering care and also providing good margins for good staff salaries along the way. Quality mental health professionals here do rather well. One of the issues that we are running into with the state of Texas, though, is the fact that a lot of licensed professionals do not want to accept Medicaid for the obvious reasons. Those obvious reasons being as though there's a lot of paperwork. There's a lot of using things like private insurance. You're going to get paid a lot more. And also, Texas is a place where you've got wealthier clients. They can afford to pay cash. This does not go ahead.
And the barrier to entry being the time that it takes to get enrolled and credentialed, as well as knowing everything that it takes to start this program.
Yeah, it really is. Medicaid doesn't make it easy. Even when we were transferred from Louisiana to here and starting a program in Texas, we couldn't find people to give us answers on how to run the program. So we kind of toiled around for about a year, really learning the ins and outs of the program about 2017. And at the point in time, once we discovered that, again, going back to the reimbursement rates and the opportunity that was there, we couldn't initially understand why Texas was so underserved. I think that about 38% of the kids here are on Medicaid. They qualify for care, but one of the ways that Texas protects this program is they don't allow a lot of adults to receive Medicaid. Your income level, your gross income level here has to be really, really low compared to a lot of states to qualify
as an adult.
As an adult. So with children being the focus when it comes to the state of Texas, you're able to, their budget is able to be, in a lot of ways, able to stay intact. Because some of these children, again, we're seeing that they're underserved because there aren't the professionals or there are not the clinics in areas where these kids have the most need. Texas, I think 98% of the state, they're stating, and you can Google this, 90% of the state is in what we call a mental health crisis. And when you designate a particular county as a mental health crisis county, what you're basically saying is that there's not an opportunity for the children in need to receive the care that they're due. And that being an issue in the state of Texas, we wanted to find a way to try to reach out and help a lot of the kids in these communities that aren't able to receive care. So after COVID, we started noticing there was a lot of need for virtual care, but a lot of that was being applied to private insurances. You can go to BetterHelp, you can go to WebMD, MedRx, and you can receive that. But that is specifically for those people that are out there receiving that have private insurance. The program that we are offering, the program that we specialize in, is called Mental Health Rehabilitation. It's behavioral health. It's a community-based program that's meant to allow your staff to go out into the field and assist the child in their own environment, which tends to be most effective. And it was created to keep these children out of the hospital. Texas is able to give you maybe roughly anywhere between $1,000 to $1,400 a month per kid. But a hospital bed in the ER would cost something like that same pretty much for that one day would be $1,400. So when you're dealing with kids that have cutting issues, when you're dealing with kids that have maybe low self-esteem, or they're dealing with a lot of what they see on the internet, or dealing with maybe they have a sleep disturbance and affecting their homework at school, or they have income insecurity at home or food insecurity at home, you're able to go in and help these kids and these families. By kind of doing that guerrilla marketing approach, by sitting there and saying, hey, look, a guerrilla approach by saying, I can offer you this in your home. You don't have to wait to see a therapist every 2 weeks for 50 minutes in a controlled setting where you're probably not going to be able to express exactly what you need because your needs are so overwhelming. And that's the great thing about the mental health rehabilitation program, is that it's not based around master's level licensed professionals. Though that the QMHP needs to be QMHP that sees that kid 2 to 4 hours a week needs to be under the supervision of an LPC. This individual or licensed professional, this individual is not providing counseling. What they're doing is they're basically providing an opportunity for that individual to deal with whatever diagnosis they have based around the treatment plan. Let's use it, for instance, if they were dealing with depression, we're allowing that individual to have tools and skills to work with that diagnosis.
To decrease symptoms of that diagnosis.
Yeah. It's especially when you're dealing with things like PTSD, for instance, a child's dealing with that. There's no cure for PTSD. But we have to help the child learn how to manage this so they can actually get to school on time and create a better future for themselves, where maybe the family, maybe the parents don't have those skills at all. We don't draw a conclusion that this parent has all the skills to teach their child. When you're meeting a single mom that's just trying to put food on the table, and she's got 3 or 4 kids, and you're walking across the parking lot to talk to her, and you say you have a Medicaid program that she basically doesn't have to pay a thing, and you're offering her assistance, it's very difficult for her to say no. That's one of the great things about Medicaid. Medicaid is the best insurance on the planet, period.
Yep.
It really is. So some of these underutilized programs, though, one thing that we're trying to do here is we're trying to stretch them, because the problem that we run into with mental health is that mental health professionals are not business people. Okay. They aren't. Our nature is that we like to help people. Okay. And that help's going to come whether we're billing or not. All right. Business people and marrying them together just becomes more like what we're doing in the hospital sector, where you see the HCAs that are joining together and putting their money together and saying, we're going to build this wonderful hospital, but we're also not going to be in a position where we're saying this hospital needs to make money as soon as we break ground. And now we are trying to create a program now, and we are actually pretty successful in doing it, that says we're able to pull a lot of these franchise fees together and offer you corporate support to deal with some of the hurdles and the pitfalls that you do with the barrier to entry with Medicaid, offer you that corporate support. And then you're able to create a very basic program with Medicaid that doesn't have a lot of bells and whistles and not the sexiest thing you're ever going to see, but you're able to help kids on the most basic level using the codes H2017 and H2014. And that's what you're doing. That's what you're doing. We're providing life skills. We're not there trying to provide narcotics. We're not there trying to add all that. Medicaid has an extensive amount of codes. They grab a lot of attention and probably actually bill a lot better than what we're doing right now. But we're trying to stay we're trying to stay basic, working with a quality mental health professional that's a bachelor's level that's unable to provide licensed care because they only have a bachelor's degree, and they can't do that until they have a master's and receive 2 years of supervision after that. So this QMHP becomes an effective tool seeing that child weekly.
Mm-hmm.
Awesome. That's great. That's great.
Do these kids typically stay with you through their the whole education system, or how long does the client typically stay with you?
Usually at least a few years.
Yeah. Okay. You're able to affect that kid for a few years. And then think about that. I mean, you're able to keep a kid for, if you were going to give a kid an opportunity to receive 50 minutes of counseling in an office once a week, and they had football practice, which one do you think they're going to choose? Right. They're going to choose football practice. All right. This program, you go out to football practice, you go out to the home, you go out to the community centers, you go out to where that child is, because 90% of it is supposed to be provided in the community. We dare say 100% is the most effective way to do it. So this child is able to have an adult, a qualified mental health professional that's there to provide them assistance where they are.
Yeah.
You talked about some success stories. Do you have any success stories of kids that you've worked with?
Yeah, we have some good ones. Mm-hmm. Good ones. And I know I'm talking up a lot here, and Aaron knows taught of this more than I do, but I had an individual that took the GED 4 times, and he ultimately always made it perfect on the math, and he always failed the rest. He failed the English. It was prolific. The way that we would look at him with math was amazing. We finally helped him finish his GED. He was able to go get a 4-year degree in 2 years, and able to get his master's in math and physics in 4 years. We have numerous children that were able to go get their GEDs with us that receive bachelor's degrees. So it really does become a system where our system in this country is, if a child is kind of underprivileged, surviving becomes the number one thing they have to do. Okay, it doesn't necessarily mean that child is any less intelligent than the other child. But I want to ask you something. When you're dealing with a tremendous amount of anxieties, how does your brain work? It is not nearly as effective as it is when you're arrested. And that applies to every human being on the planet, no matter what privileged area you were born in or not born in. Anxiety will derail you. Trauma will derail you. And it takes on different forms because it takes Stress takes on a bodily form and affects the way you live your life. What we try to show these children how to do is not tell them, hey, everything's going to be okay, or hey, you should pray about it, or hey, you should do this. We try to give them practical means on how they deal with the stress that comes in their life by having real conversations that they're probably not able to have with their parents.
Yep. And help the family system get things that they need regarding like food insecurity, housing, because there's some case management involved as well.
Yeah. We did have a child. I'm glad you said that. We did have a child, for instance, that I had to fight the school board on, and it really was an argument that they wanted to throw this kid out. Ultimately, they brought in the mom and said, "Hey, we're not going to be able to do this." In the middle of the session with the mom and the school board, mom admitted that she was 28 years old with 9 children, and she was giving him 1 bag of popcorn a day. All right, the kid was stealing money out of the teachers' purses because he was hungry. Sick. He was, yeah. And they said, we can't sit still. And the one thing I asked him, I said, have you ever eaten you haven't eaten for 2 days and tried to sit still? How about try to learn math? How about try to do the most basic things? How about just try to be respectful to someone?
Yeah.
It's going to be very difficult if you're hungry. Yeah. And this is where I think we're missing things. We have a real big emphasis when it comes on mental health to the counseling piece. We want to get them in and we all want a counselor, right? It feel really, really good. You have those aha moments and, you send that kid back. You go, man, that was a great session with that kid. And you send him back to a crack house. Okay. You send him back to a house that doesn't have food in the cupboards. You send him back to a house where mom is still dealing with trauma that she got from her own parents. And you're expecting that piece to not be generational. And then we all get together and we put our money together and we do Toys for Tots and we give money on Easter and on Christmas. And we feel like we're doing a damn thing. We're not really doing a thing. These kids need something consistent. And a lot of the times when it comes to investments, we're not willing to do that. We just want to feel good for the moment.
Yeah. Charlie, can you go into an area and can you go a little bit into your background and, where you started with this whole journey and, how you got to the point you're at now?
Did you start that?
You're good. You're better at telling.
I've been doing this for years. In the early mid-90s, I worked at a place that was affiliated with the Young Life Christian organizations, and I was able to go to grad school during that period of time. And in the middle of my grad school adventure, I was hired on by a large facility in Colorado after a riot. And I was able to work with kids there that were from Chicago and from Philadelphia that had conduct disorder. I took that part of my career and started working deeply with conduct disorder and really a lot of direct care. And then I started training people that work with direct care, TCI, which is a crisis management system. With that crisis management system, I got pretty good at working with de-escalation techniques and also teaching active listening. And over time, I started training larger and larger groups of people in this area and started specializing in post-traumatic stress disorder. Once I received a great mentor that had gone to Vanderbilt, that kind of took me under his wing. So, and got to meet you.
Yeah. Nice to meet you.
Fantastic.
And your background's pretty impressive. I don't want to tell it for you. You can tell who the clinical director is. She's like, and I'm going to listen.
Let's see. So my first graduate program was for special education. I used to teach children with special needs, specifically children with autism. That was leaning heavier on the spectrum where just functioning really low. Mm-hmm. I changed my graduate program from that to counseling, became a licensed counselor, and we began this program in Louisiana.
Yeah. Arienne has a very strong skill. You can probably see the differences between us even on camera here. She can be the backbone of everything that we do. I can be the mouthpiece. She can be the backbone. And I feel like one of the strengths of even us being married and doing this together is that I would work with her regardless whether we were married or not, because her skill set is very specific to her own and one of the strongest I've ever seen. If you were to question anybody about that, they tell you that here. She's immensely detailed. She has a strong sense of character. She has a strong sense of what these kids need too. So, and our treatment plans reflect that. So the one thing that when we're building this system here, the one thing that we want the kids to know is they have a voice. Well, the way that they have that voice is you listen to what they have to say and you build that treatment plan around them. This QMHP does not step out of that treatment plan because they're not therapists. They're not counselors. They're there to help this individual manage what they're dealing with. Well, expecting a child to say exactly what they need, ridiculous. Okay. Yeah. A reason a 4-year-old cries when they don't get what they want is because they don't have the words. Like I told you guys recently, one of the reasons that, 5-year-old girl, 5-year-old boy, they scrape their knee. Boy, you tell a girl, you say, come here and talk to me about it. 5-year-old girl, 5-year-old boy, you tell them to put some dirt on it. It's one of the reasons that when we get older as men, we don't communicate very well. It's because we've often been told that we should communicate in this way, right? Arienne's treatment plans recovery plans are built on with that knowledge in hand. Learning as much about the kids as we possibly can in an hour to 2 hours, revisiting that, arguing that treatment plan, taking all of this information that QHBs say and adding a clinical side to it so that we're able to further help that child with the information they give us now, but revisit it again in 90 days to 180 days to see exactly if maybe we missed something. That's the effectiveness of this program, is because you've got these great QMHPs running out there like they got their hair on fire, and they're out there seeing these kids on just the ground level. They're getting all this information, all the FUs, this is what's going on with me, all the long stories that they need to get out, and communicating their feelings in a completely different way, much like men do. A lot of the times we say we're angry when we're sad, teaching them new ways to talk about things. And then you watch this child grow. You watch them grow because their words become stronger, because now that they're being listened to, their thoughts become a lot more organized.
Yeah.
Okay. Because imagine the times that you've been in a relationship before where you didn't have someone that listened to you and how frustrated you were telling how you felt. And then when you were in a calmness with someone that you knew cared about you, you're able to slow down and talk about exactly what you feel. And you maybe discover some things about yourself you never knew. That's what we're trying to do with these children. Because the problem when it comes to poverty is that children that are typically poor don't have the same amount of communication resources at their disposal as kids that have been taken care of most of their lives in a more affluent situation. That's our purpose of our program, is life skills. Again, it's not the sexiest program. The program has a mission, and that's showing that child how to manage the symptoms around their diagnosis, if there is, and there will be one, and also helping that child learn to communicate, because communicate and emotional well-being are completely tied to one another. If you can't talk to someone about how you feel, you start feeling as though the way you feel does not matter. You start feeling the opposite of valid. You start feeling like an invalid. And that's the worst way to feel when it comes to being a child.
Yeah.
Or for that matter.
Absolutely. Well, we definitely appreciate your story, and we're excited about what you and Andrew and Arienne, what you guys have put together here, and we definitely appreciate it. And I think we're going to move over to Andrew now, if that's okay, unless you guys have any other thing you'd like to add.
Thanks for your time.
Yes, thank you.
Appreciate you guys.
Awesome.
All right.
Appreciate it.
Awesome.
Thank you.
Okay.
I
Sounds
know
good.
you're busy, so I don't want to.
Thank you, guys.
Get you guys out.
Appreciate it. Yep.
Hey guys, how are you?
Good. How are you, man?
Yeah, good, good. So, one of the main things to second a lot of things that Charlie and Arienne was talking about, I'll go and send you guys a report detailing the details of Texas Medicaid. I didn't even realize this. 38% or 36 or 37%, 3 out of 8 children in Texas is on Medicaid. Of all children in Texas. I did not know it was that bad.
Yeah.
And regarding if you take a look at the P&Ls, remember, this is designed for our clinics to be extremely successful. All we need is 50 kids. We're not talking millions of kids. We're not talking hundreds of thousands of kids. We're talking about 50 kids per location.
Yep. So, Andrew, could you talk a little bit about, where you came from, how you got to be involved with this program, and the details of what we're going to do going forward?
Yeah, for sure. So I came from, this is funny because Anton and Eric, you probably heard this thing about 4 different times already. So I'll go and start off from the top. So I came from a business background. I learned from a very early age that, I don't take authority very well. Kind of got into entrepreneurship and never really turned back. In fact, my first job out of college, I was recruited to become an account manager for a hospital. I found out probably within 2 hours on the job that I was a 9-to-5 cubicle material. And my second week on the job, I decided to go to lunch and don't come back. So not something that I recommend, but that was something that I was not passionate about. So I decided to go into real estate. and did extremely well with real estate. And, in fact, my first month in real estate, I actually made more than my annual salary at the hospital. But unfortunately, for a 20-something-year-old kid that came into that kind of money, I became very stupid with money. Went through 9 cars in 3 years, just spent money like, it had an expiration date and it grew on trees. And all that came to a screeching halt when 2008 and 2009 came, and went from making a lot of money in real estate to making absolutely no money in real estate. So decided to move from San Antonio to Houston, hoping a larger city would have more real estate opportunities. And as soon as I got here in 2009, I realized that the larger cities were affected more so than the smaller cities. So I had to do something. I couldn't draw unemployment because I was self-employed, and nobody was even wanting to talk real estate. So we had to do something. So went to luxury apartment complexes, set up boot camp classes. I mean, that's what my wife and we did to put ourselves through college. So we had a little bit of fitness background, and we noticed that the clients that saw the best results were the ones that ate properly. So we decided to start cooking for them, and then we started a little company called Perfect Fit Meals. Long story short, Perfect Fit Meals went from a smaller than mom and pop operation, and at its height, it grew to over 5,000 retail locations that carry the product in about 38 states. So, every single major grocery chain carried our product, including Costco, Sam's, Walmart, local chains like H-E-B, Publix, Schnucks. Didn't matter what part of and even in your neck of the woods, we had Lunds and Byerly's. And all the major chains like Kroger and all its affiliate brands, and Albertson Safeway as well. And then in 2019, we exited the company partially due to the fact that the internal politics of the company was getting to me. We grew the company from nothing to almost 300 employees. And it was just getting to the point that we decided, moving on was the best thing for us. Immediately after moving on, I was approached by a lot of different other manufacturers. And basically came to me with an opportunity to basically do what I did for my own company, but for everybody else. So why that is relevant for our is over the course of the last, going on 2 decades, we were very effective on building brands. And, a lot of, with our own company, we took it from a very, very smaller than regional player to a multi state. And with other manufacturers, we did exactly the same thing. We took regional players and then basically expanded them by building brands, by, creating effective marketing programs. And essentially, like as we all know, it doesn't matter if you have the best product in the world, but if nobody knows about you, it's not a successful model. And contrarily, even if you don't have the best product, as long as your customers believe that you have the best product, then you're golden. So from then on, COVID hit, and we set up a import-export company that essentially brought in a lot of things that were in need when the U.S. supply chain collapsed. So everything from packaging to raw materials to chemicals to ultimately automation equipment when the U.S. labor force collapsed because the stimulus checks was paying people to stay home. So life was actually pretty good. Prior to getting involved, I was probably working about anywhere from 3 to 5 hours a week, due to the fact that a lot of the businesses that we set up was very, very passive. On the import-export stuff, whether I'm asleep or on the beach in Cancun, the boats are still running, right? So I was actually how I got involved with is Charlie and we actually known each other for about 8 years, ever since they moved from Louisiana to Houston when they exited out of their clinic in Louisiana. We hit it off immediately, but due to the proximity where they moved to in Houston, they live in Conroe and I live in Richmond. we're all technically in the Houston metro area, but Houston's very, very spread out. From one end to the other is about an hour and 30 minutes without traffic. So with traffic, with a notorious Houston traffic, all bets are off. Just because our proximity, we weren't hanging out every other week, but we always kept in touch on what each other, what we were doing. So, how we linked up is I was actually looking for more passive investments. So when I heard that, I immediately, invited them over to lunch to evaluate what the program was about, and requested P&Ls. And when I saw the P&Ls, I was blown away. I've been doing this investing for going on a better part of 2 decades now, and this is one of the strongest P&Ls I have ever seen in my life. So, I immediately, after meeting with them and talking about the mission and talking about what they were doing and what the company was about, and I always knew they were doing well. I just didn't know that the P&Ls reflected how well and they were doing that well. So immediately, when I saw the opportunity was available, I put my money where my mouth is, and immediately wired over for my own personal franchise. Initially, I'm not going to lie, it was all about the money. It was all about return on investment. I was looking for a passive way to basically have my money working for me. That was the beginning. Until I got a little more involved, and until I started, listening and basically learning, the type of work that they're doing and how bad everything is in terms of mental health, not only here in Texas, but just about everywhere. And what we've done is, we took a look at if I was able to marry and pair, the system that they have, along with the, multiple decades of experience of care, and, going into having a system that basically knows what's effective and what's not in terms of working with these kids, and then pairing that with a brand that we could build. Because on the medical side, as Charlie have mentioned, there's a lot of different brands. I mean, whenever you think cancer, you think MD Anderson. Whenever you think here in Texas, whenever you think children's adolescence care, you think Texas Children's Hospital, because those are very, very strong brands that they have built. But on the psychiatric side and the behavioral health side, there is hardly anything. You have usually some of the clinics are run like Charlie and Arienne mentioned. They're run by the licensed LP themselves, and by nature, these are the type of people that's more about care and less about making money, because they're not born natural capitalists. They're not right. They're not essentially business people, right? And by nature, these people, they try to give away so much of their work for free, and by trying to do everything, they wind up doing nothing well. And this is when we said, hey, if we could take your system and apply the business knowledge that we have, what can come out of it? And if we are able to do this correctly and do it right, how many kids can we wind up helping? And that's what we did. And we developed a pretty effective system. And by marrying the two concepts, in the last 7 weeks, we brought on 25 franchises, and it's growing exponentially. And it's the pace at which franchisees are coming in is actually growing. And the reason why I say that is because I know there's a couple of different things. What I want is build up a brand that is so strong that whenever a social worker picks up the phone and says, hey, you know what? I have 10 kids I need a place. I want to build a brand that is so strong that she's not thinking about calling anybody else except us. Right. And, with the entire state being in a state of mental health crisis, I truly believe we're in a perfect storm. Right. The margins is one of the strongest I ever seen. We pay our people anywhere from $25 to $35 an hour, and we get to build the state of Texas 102. This is one of the only businesses I know or actually the only business I know, in traditional business, if you're in a podunk little town in Texas versus downtown Austin, you have to charge 10 times as much in downtown Austin. I don't care if it's a burger franchise, a burger joint, or a dental office. You have to charge 10 times as much in Austin due to the fact that you have to cover your overhead. Well, in this case, Medicaid pays 102 for billable hour reimbursement. Doesn't matter if they're on the border or they're in downtown Austin or Dallas. This is also the only business that I know that comes with a built-in referral program. The reason I say that is if you take a look at the demographics of Medicaid recipients, most of the time, single parent or single mom usually, and multiple kids. And as they mentioned, Medicaid is the best insurance policy in the world. You and I, we just don't qualify for it, right? But for those that do, if you could help and change for the better the worst of her kids, guess what she's going to say? Please take all of them, because it costs her absolutely nothing. And this is the beauty about this entire business model that I see, is that, once again, 3 out of 8 kids total in Texas is on the system that we could apply for, right? And I mean, guys, the sky's the freaking limit, man. And that is why I'm so passionate and so excited about this, because, at the end of the day, if we do this correctly, not only as investors, we're going to make a ton of money, but we are able to change the lives of a lot of these kids that, quite frankly, was dealt a very, very bad hand. Going back to what Arienne and Charlie has mentioned, we're here essentially as a big brother and big sister program to teach these kids life skills, getting them ready for whether it's trade school or just keeping them out of jail, out of emergency rooms, and out of the morgue, right? And essentially teaching these kids life skills, turning them from what society has deemed undesirable and complete rejects, and turning them into productive citizens. And if we could do that effectively, guys, I would consider, a great mission for me personally, at least.
Yeah. Yeah, I agree with you, man. It just it feels good to be able to be there with such a problem going on in this country. And I have a story for you later. That's something happened to my daughter recently with another girl. But man, it's pretty heartbreaking when you hear some of these stories and stuff.
Yeah.
Could you just maybe kind of just tell the process of start to kind of finish, where somebody starts, what's
Sure.
what the first thing they do, and then what that process looks until they get their care center open?
Sure. So the process, like I mentioned before, with this, I'm gonna tell you the good, the bad, and the ugly of anything, because we're very, very transparent when it comes to what we provide, and we don't want anybody to be surprised. So the bulk of the franchise fees, in fact, I would say currently right now, all of the franchise fees is going to make sure that here at corporate, we obtain the best staff available, and the best support available for us to be able to support and build upon the system to essentially support and help the franchisees in every way possible. So initially, the $65,000 franchise fee that comes in is essentially going towards making sure we help with the accreditation process, making sure that corporate has the support and the staff to answer any questions on your behalf, or provide the support that you'll need to get your center open. So the steps in which happens is that once you decide that franchise is something that you want to pursue, you pay the $65,000 upfront, and immediately the accreditation process starts. Now, this is where the ugly part of this happens, just dealing with the state. As we all know, working with the state, everything is you're working under the state's timeline, right? even if you submitted every single piece of document that the state requires or the insurance companies require today, it is still a 6-month accreditation process. However, we do have the staff here at corporate to basically walk you through every step of the process. In fact, a lot of the accreditation process is going to be done for you. We just need your cooperation in terms of making sure that you submit all the documents or fill out all the paperwork that we're going to send you. Right. The sooner that you do that, the sooner the accreditation process will start. So once again, dealing with the state, the accreditation process will take as long as everything is done, right? So if one piece of paperwork is holding it up, that 6-month clock doesn't start until all of the paperwork is done. And trust me, some franchisees are really, really good about submitting everything on time. Some franchisees we have to track down. But I tell them, one of them, I finally had to say, hey, guys, I need you guys to know that your 6 months doesn't start until all these documents are submitted back to us, right? I need you guys to realize that. And whenever they finally clicked, that's when I finally got all the paperwork done. And thank God we have an entire staff here at corporate to track those down, because I would go insane.
Yeah.
Part of
They're
that,
a lot more political than I am when it comes to getting what we need back.
part of that
So
too, they also need to have an LLC created
correct.
in the state of Texas.
Yes. So actually, that is one thing I will ask Charlie. I'm gonna go and grab him. I don't know it has to be a Texas LLC, but getting a Texas LLC set up is very, very simple.
Yeah.
It's a $301 filing fee, and then once you have that, you could go on the IRS website and generate a EIN number,
Yeah.
and most of the time is actually generated on the spot.
Yeah.
So that process is pretty simple, and then getting the FDDs signed, and then once we identify all the owners, getting the W-9s out, getting the bank account set up. But all of that process, the beauty about this is you do have what we need immediately is getting the LLC, getting the EIN number, and getting all the background checks in place, all the photo identification in, all that process, which sounds really, really simple, but with some of these people, tracking them down, getting all this documents when they're very busy business people could be, some of them take a day, some of them takes 2 weeks, right? But we just got to disclose that, hey, that 6-month accreditation process doesn't start until not from the time that you pay your franchise fee, but that starts whenever you submit all the documents needed for the accreditation process. Our girls here, they work extremely hard getting everything filed with the state very effectively, but we still need your cooperation for that to happen.
Right.
So once the franchise fees end, our accreditation team will get in touch with you to get all the documents required. Getting an LLC set up, like I mentioned, is very, very simple. And then we will actually get you set up with a good RX phone number. We'll help you get the limited liability insurance set up, all of the things that's required for Texas Medicaid. And then right around month, probably about 4 or 5, that's when we need to really start looking for a space. Because currently right now, as long as you have a physical address in the region that you're going to be, then Medicaid will accept that physical address. It cannot be a PO box. It has to be a physical address. But right around month 4 or 5, that's when you really need to actually find a location for your office to be in, and that's when we also send out our marketing and community outreach people to go out and start targeting marketing for your location, making sure that as soon as you open and your accreditation process is done, as soon as your doors are open, your clinic is running basically as soon as you hit the ground. So our goal is to make sure that this investment for you is very, very minimal in the time that it takes for you to open. And once it opens, our goal is try to get you into the black as soon as possible.
That's awesome. Can you tell them a little bit about, I'm sure people listening right now are thinking, oh, I need to go find a location or I need to go rent out a space. Tell
Sure.
them how easy that part of it is and how cost effective that we can do it because of the way
Sure.
that you guys do it.
Yeah, so remember the nature of this program is designed for most, if not all of the work to be done in the community. So the office is definitely not something where the office needs to be the main focus. Or the clinic. We're not opening up a health spa where we're trying to attract people from the street, right? So the beauty about this is a lot of our customer or a lot of our franchisees has been utilizing an office, utilizing a Regis or WeWorks type of office, as long as it has the space to house a admin person or a front desk person, and a couple of rooms essentially for your QMHPs to do team meetings and to basically come and pick up their check, really, and a little area for place where all the files can be locked. That's all you really need. So some of our offices is nowhere not more than 600 to 1,000 square feet, and we're talking around three to I've seen it as low as $300 a month, because by nature of working in these underprivileged areas, the benefit for that for us on the investor side is they're also very low rent areas as well, because we need to go to where the help is needed. And fortunately for us as investors, those are also the areas of the city where rent is much, much less.
Yeah.
We're not talking about offices in Rodeo Drive here.
Yeah. Yep. That's perfect. That's perfect.
Also,
Fantastic.
if you want to go over, I guess, the franchise fees and then the royalty side of it.
Yes. Yeah. So the franchise fee is 65,000, and the royalties are 13%. We have a lot of we don't have a lot, but we do have some people that are used to like food franchises. The food franchise guys, they always come back and say, "Whoa, you know what? I mean, 13% is a lot. With my burger franchise, I only pay 6%." And then my next question to them is, "Well, what is your net margin on your restaurant?" It's like, well, on a really good year, probably 13, 14%, average 11 to 12%. It's my net margin. I was like, oh, okay. So if they want 6% of that, you're giving them half. For us, it's 13%. However, we're looking at a net margin of around 60 something percent. On top of all of this, we're not asking. This is a very, very passive investment for most of our franchisees. Now, if you want to go out there and do more community outreach on your own because you have a passion with kids, by all means, that's only going to help your clinic. But we're talking about an investment where you're paying 13% of only what's coming in. So only on your gains. And by the way, we're going to provide you all the clients, and we're going to train all your staff and hire all your staff for you. Right. So essentially you're paying 13% on, on an investment that is passive.
Yep.
Yeah.
Tell me what passive investment have that kind of return?
Yeah.
Right.
Yep. That's amazing.
Yeah.
And I think the beautiful thing here is that, Charlie has been doing this a long time, and Arienne, and combining the skills that they have in the mental health care, arena, and then having your skill with building businesses and scaling businesses. And the combination of the two to me is just amazing. And I think it's a really, really good opportunity. And just having everything in place and having you guys do everything for us, essentially, and we can,
Yeah.
and Eric and I are the kind of guys that we want to be involved. We want
Mhm.
to help you guys out as much as we can. And the fact that you're going to probably have a lot of partners that come in and invest, they're probably feeling the same way. You know, they want to try to benefit you guys and help as much as they can. And I think you're
Sure.
going to get a lot of that when a lot of people start to come in and see this.
Yeah, yeah. Well, I think honestly, you guys coming in at this time, this is the best possible time to join. Because we are at the ground level. At the end of the day, we are on track to get about 300 centers open in the next 18 months. I mean, and it may accelerate even beyond once the owners start seeing their own P&Ls. Because at the end of the day, if you have an investment that you pay $65,000 on and it's netting you, let's just say very, 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 very conservatively, it's netting you 10,000 or even 15,000 a month on a $65,000 investment.
Yeah.
How many of these centers do you want, right? So I truly believe that the number of centers is just going to accelerate exponentially once the P&Ls start coming in. And the beauty about all of this, guys, is, this is my personal belief that recession is coming, whether you believe it or not, whether you like it or not. And this is one of the only businesses I know that is recession proof. In fact, I will go one step beyond that, is that I truly believe that we will actually benefit from a recession, because that single mom that just got her hours cut is now under more financial stress. Unfortunately, sometimes they're going to take it out on the kids.
Yep. That's awesome.
And with social media, with kids glued to their phones nowadays, with all the bullying that happens because of social media, I don't think mental health is going to get any better anytime soon, guys.
No. Well, thank you so much for that, Andrew. We really, really appreciate all of your input and all your expertise, and it's just really good to, get you on here and get everybody to know you as a person. And you can feel the passion and you can hear the passion in your voice on how much you care about this project, and we're really excited to work with you.
Yeah, looking forward to it. And I think, honestly, if we put all of our resources together, I truly believe that we're going to change a lot of lives for the better and a lot of money in the process, guys.
Yep.